you press harder. We can do this. But if you haven't gotten vaccinated yet, now is the time. And with that, over to Dr. Walensky for an important update and what our progress means for Americans.
Thank you, Andy. Good afternoon. I'm pleased to be back with you today. Let's begin with an overview of the data. Yesterday, CDC reported more than 34,200 new cases of COVID-19. Our 7-day average is about 36,800 cases per day. This represents yet another decrease of about 23% from our prior 7-day average. And every day, with daily cases continuing to fall, we remain encouraged by these positive trends. The 7-day average of hospital admissions is 4,100. Again, another terrific sign with another back-to-back decrease of 12% from the previous 7-day period. And 7-day average daily deaths have also declined to 587 per day. Today, I have several exciting announcements to share with you. First, since becoming CDC Director, I have seen firsthand the current frail state of the public health infrastructure in this country. I'm committed to upgrading the public health system so the nation is ready for whatever comes next. With this in mind, today we are announcing the upcoming release of $7.4 billion in funding from the American Rescue Plan to hire, train, and support public health workers across the country, reflective of the diversity within the communities they serve. Over half of the money being released, $4.4 billion, will support states and localities, creating tens of thousands of new jobs in communities across America, expanding our overstretched public health departments with new hires to support their COVID-19 efforts. And $3 billion will be focused on preparing these same jurisdictions for future pandemics and to build a public health workforce for the future. Though many threats have increased in complexity and scale in recent years, our nation's public health workforce has gotten smaller. This support will immediately add more staff in health departments across the country. It will add school nurses to K-12 schools to support safe reopening and operations and support vaccinations as vaccines are authorized for younger people. It will expand the number of CDC Epidemic Intelligence Service officers, our elite disease detectives, to respond to local outbreaks and help curb the pandemic. It will expand public health career paths, recruit and train a diverse group of future public health leaders, and launch a public health AmeriCorps to recruit a strong, diverse, and highly skilled workforce that is ready to respond. And it will create new programs intended to increase staffing at our nation's laboratories and build preparedness for the future. We are really excited about what this support will mean for our nation's public health capability now and into the future. Second, last night I endorsed the recommendations of CDC's Advisory Committee on Immunization Practices, making the Pfizer vaccine available to anyone who is 12 years and older. I want to thank the ACIP for reviewing the science and providing their recommendations on the safety and efficacy of the vaccines in adolescents. This is an important step forward in our efforts to vaccinate as many people as possible and to stop the pandemic. And finally, I want to provide you an update regarding CDC's guidance for fully vaccinated people. Over the course of the pandemic, we are continuously gathering data and evidence to inform our guidance and decision-making. We now have numerous reports in the literature that demonstrate the safety and real-world effectiveness of the authorized vaccines. On this slide, there are 3 recently published studies, one from Israel published in the Journal of the American Medical Association, or JAMA, on the top, and 2 from the United States, both published in CDC's Morbidity and Mortality Weekly Report, which all show that COVID-19 vaccines work. In Israel, there was a demonstrated 97% vaccine effectiveness against symptomatic and 86% effectiveness against asymptomatic infection in over 5,000 healthcare workers. In the United States, vaccines were 90% effective against any infection in nearly 4,000 healthcare workers and 94% effective against hospitalizations from COVID-19 in an evaluation across 24 hospitals in 14 states. Additionally, we are accumulating data that our authorized vaccines are effective against the variants that are circulating in this country. On this slide, you can see a study published just last week that demonstrates how effective the Pfizer vaccine is against the common circulating variants in the United States, B.1.1.7, as well as other variants like B.1.351. Additional studies confirm that the Moderna and Johnson & Johnson vaccines are also effective against circulating variants. Finally, we know that in the rare event that people get infected after a vaccine, the resulting infection is more likely to have a lower viral load, be shorter in duration, and likely less risky of transmission to others. Considering all of these factors, the data on vaccine effectiveness, the science on their ability to protect against circulating variants, and our growing understanding of the low risk of transmission to others, combined with universal access to vaccines for those 12 and older, today, CDC is updating our guidance for fully vaccinated people. Anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing. If you are fully vaccinated, you can start doing the things that you had stopped doing because of the pandemic. We have all longed for this moment when we can get back to some sense of normalcy. Based on the continuing downward trajectory of cases, the scientific data on the performance of our vaccines, and our understanding of how the virus spreads, that moment has come for those who are fully vaccinated. Now, if you are immune compromised, you will most definitely want to talk to your doctor before giving up your mask. Also, locations such as healthcare facilities will continue to follow their specific infection control recommendations. And lastly, this past year has shown us that this virus can be unpredictable. So if things get worse, there is always a chance we may need to make change to these recommendations. But we know that the more people are vaccinated, the less cases we will have and the less chance of a new spike or additional variants emerging. If you develop symptoms, you should put your mask back on and get tested right away. The science is also very clear about unvaccinated people. You remain at risk of mild or severe illness, of death, or of spreading the disease to others. You should still mask, and you should get vaccinated right away. This is an exciting and powerful moment. It could only happen because of the work of so many who made sure we had the rapid administration of 3 safe and effective vaccines. It could also only happen because we have an adequate supply of those vaccines for everyone 12 years and older in this country.
We've been listening to the White House COVID briefing.
Shepard Smith here. Thanks for watching CNBC on YouTube.